Salam sejahtera and good morning to everyone.
We are from Group 2.
Today, our presentation is about the impact of shift work on nursing students' academic performance.
Before that, let me introduce you my group members. I am Shufi, and the rest is Izati, Amira, Salsabella, Yusra, and Mimi. Now I will start with the introduction.
In Malaysia and around the world, an alarming trend is happening in higher education. More and more students in professional program, especially nursing students, are working in shift jobs while studying. Nursing students face many challenges. They need to balance their classes, clinical training, and sometimes family responsibility, while also working to pay for their tuition and living costs. This situation affects not only their learning but also the quality of nursing education, and that is important because nursing education is directly linked to patient safety and the future of our healthcare system. So, understanding how shift work affects nursing students' academic performance is not just important, it's urgent.
Let's move on to the background of the study. Many studies have shown that a large number of nursing students work part-time or take on shift job to help pay for their tuition and living expenses. Even though this helps them financially, it also causes many problems. Working long or irregular hours often leads to lack of sleep, tiredness, poor time management, and less time to study. Previous research also found that shift work can reduce concentration, lower academic performance, and increase stress levels among students. These effects are even more serious for nursing students because their course is very demanding. They have to manage clinical placement, laboratory session, and many exams, all while trying to keep up with their studies. Although this issue has been discussed among general university students, only a few studies have focused specifically on nursing students. Because of that, our study aims to explore how shift work truly affects their academic performance and overall well-being. Thank you. So I will pass to next presenter.
Next, I will present about the problem statement for our research. So many nursing students today are working part-time or doing shift work to support their education and living costs. However, these irregular working hours often clash with their academic and clinical schedule. So as a result, students may experience tiredness, poor time management, and high stress level, which can lead to less study time and lower academic performance. Although there are studies showing that working students often face lower academic achievement, there is still a lack of research focusing specifically on nursing students. This group faces challenges such as long clinical placement and difficult practical exam, which make their experience different from other students. Because of limited research, educators and policymakers may find it hard to provide proper support for nursing students. Therefore, the main problem identified is the lack of specific evidence-based data to help ensure nursing student success and strengthen the future nursing workforce.
Hi, my name is Sabila binti Rosli, and I will be presenting my part, which is about the research objective and research question of our research. So, I will explain the main objective. There are three main objectives. First is to examine the effect of shift work on the academic performance of nursing students. This means we want to understand whether doing shift work influences their grades or learning outcomes. Second is to identify the challenges and difficulties experienced by nursing students who undergo shift work. Through this, we can find out what kinds of problems or stress they commonly face while balancing work and study. Third is to observe the coping strategies used by nursing students to balance shift work and study. This helps us to know how students manage their time, stress, and responsibility effectively. Next, let's move to the research objective. From these objectives, three research questions were developed. First, how does shift work affect the academic performance of nursing students? This question focuses on whether shift work has a positive or negative impact on their studies. Second, what the most common challenges faced by nursing students due to shift work? Here, we want to explore the types of difficulties they usually encounter, such as lack of sleep or time management issue. Finally, what coping strategies are used by nursing students to manage academic demands while working shift? This question aims to understand what method or strategies students apply to maintain their academic performance while working.
Assalamualaikum and good morning. My name is Amira Nabila. We will be presenting the research methodology of our study. This research uses a qualitative approach to delivery research. Instead of collecting data directly from nursing students, we rely on published articles, journals, and reports that discuss shift work among nursing students. By comparing the findings of different authors, we were able to identify recurring themes and differences which together give a clearer and more complete picture of the topics. In analyzing the data, we applied the descriptive method. This means that we reviewed, summarized, and interpreted information from various studies to highlight their connections and implications. This method is suitable because our goal is not to test a hypothesis, but we gain a deeper understanding of how shift work affects academic performance. It also allows us to explore the challenges nursing students face and the coping strategies they use to manage both study and work. Lastly, this approach provides value insight that can guide educators, policymakers, and researchers in improving support for nursing students and future healthcare professionals. Moving on the literature review, several researchers have studied how shift work affects nursing students' academic performance. For example, Kabaya 2034 reported that irregular working hours cause fatigue and reduce concentration, making it harder for students to maintain effective study habits. This showed that demanding schedules directly interfere with learning consistency. Next, Musavi 2035 found that night shift disrupt sleep cycles, leading to poor memory and lower classroom participation. The study linked the problem to circadian rhythm disrupt, showing that biological factors also influence academic performance. In addition, Gallego Gomez 2031 examined sleep habits and found that almost one-third of the nursing students had poor sleep quality and short sleep duration. This habit was strongly related to weaker academic results, showing how lifestyle patterns affect performance. The physiological aspect was highlighted by the Al-Hashrani 2020, who reported that nursing students experiences stress and time management difficulties while balancing clinical and academic responsibility. This factor lowered academic performance, proving that mental strength just as important as physical fatigue. On a more positive note, Zhang 2030 emphasized the role of coping strategies such as time management, peer support, and adequate rest. Students who use this strategy could adapt better to shift work and achieve stronger academic results. Overall, previous study consistently show that shift work negatively impact nursing student academic performance through fatigue, sleep duration, and stress. However, most studies were conducted in different cultural of institutional setting, so the result may not apply everywhere. That's why our study is important. It brings together existing evidence to provide a clearer and more comprehensive understanding of how shift work affects students, the challenges they face, and the coping strategy they ask. So that's all.
So hi, my name is Nuri Izzati binti Muhammad Shukri. So I would like to continue the research analysis part. So actually for our research, we use the descriptive method to summarize the characteristics of the nursing students and their academic performance. We presented the data using frequency, percentage, mean, and standard deviation. So to show the details like demography, type of shift schedules, average study hours, and the student GPA. So this method actually helps us to see the overall patterns of the sample, including how many students were doing night shift and how this related to their academic result. We also presented the findings using tables and graphs, so to make the information clearer and easier for us to compare. Through this visual, we could identify trends and see the difference between students who work frequent night shift and those who had regular daytime shift. So this descriptive approach gave us a strong and clear information before moving on to the deeper analysis of the relationship between shift work and academic performance for the nursing students.
Okay, for the conclusion, the research on shift work and nursing student academic performance is timely and necessary. Balancing classroom learning with irregular clinical shift can disrupt sleep, increase stress, and also reduce concentration. Poor sleep quality and fatigue often lead to decreased alertness, impaired memory, and also lowered academic or clinical performance. So the finding that we find is to suggest the flexible scheduling, sleep management, and physiological support can improve well-being and also academic success. The result may guide nursing school and training institutions to create healthier policy. Lastly, the study is about preparing resilient and competent nurse for the future practice. That's all from us. Thank you.